Well, thank you so much, Karin, for joining me. So far, it's been a pleasure. All right, can you first just tell all of us, what is it exactly that you do?
So right now I work as an analyst, specifically a denials management analyst for Shriners Hospitals for Children. Shriners Hospital is a non-profit organization. We have 20 hospitals across the United States and then one in Canada and one in Mexico. So what we do is, basically it's a children's hospital. So we provide care to pediatric patients in select specialties like orthopedic care. We do a lot of cleft lip and palate surgeries, spine surgeries, and we do have a big burn facility in Galveston also. So we provide that care regardless of the parent's ability to pay for that care. So that means that if your child is a patient at Shriners, we might still bill your insurance, so whatever insurance pays for the regular care, but then the co-payments, co-insurances and all that, we will see if you qualify for the charity care, but you most likely will. So even if you receive a statement and it's not paid within 45 days, it's an automatic write-off. So nobody is going to be denied care or going to bankruptcy as a result of receiving care from Shriners. So what I do day to day, it's basically a reporting position. So it's a lot of like data, looking at a lot of data, specifically denials data. We have, so the 20 hospitals, we don't touch the Canada, we don't touch the Mexico one because it's a different system. But the 20 that we have in the United States, we have split between the two analysts. So it's 10 and 10. I take care of the 10 and my counterpart Melody takes care of the other 10. And I run reports monthly. I kind of look for trends. I see a bigger dollar denial, see what's going on, can we still recoup the money? And just look to see what's basically going on with denials month to month. And then I create a report that contains rolling 12 months of all denials for that specific facility. I send it out to the facilities, I send it out to our centralized business office. It's kind of like an outsourced business office who does all the billing and collections, that kind of stuff. So I send it out to them, and then we have a monthly call where we discuss those denials. So we discuss it with the leadership, with the facility, with headquarters, and discuss and see what we can do, if there are any trends or issues that we can implement a fix so it doesn't happen going forward, so that we can retain more of the revenue so that we can then reinvest it into the care for the children.
So by the time that it gets to you, and you guys are going through the denials, is it like a done deal then? So it's denied. You guys were not getting paid for those services.
It has, but that, yes.
Or do you guys still at that point get to like appeal?
We get to appeal also, yes.
Okay.
Part of my team, we have also 2 appeals nurses, but the kinds of appeals that we take care in-house are the medical necessity ones. So if something denies for lack of medical necessity, or because, let's say, level of care, let's say the payer thought it should be observation level of care, and we felt that we need to admit them inpatient. If there is this kind of discrepancy, then an appeals nurse will take a peek, and if she agrees that it should have been outpatient, which sometimes happens, because we have a history of not billing anything. We started only billing claims out after the 2008 economic downturn.
Okay.
So before that, we didn't have a revenue cycle really in place. We just did whatever. Like we felt like we want to admit somebody, so we did, because it didn't matter, because we didn't bill anybody. So nobody else were to look or to judge. So yes, it has been denied by that point. However, there are still recourse, appeal, reconsideration. If it denied incorrectly, then our CBO, the Central Business Office, might be able to contact the payer and reference, let's say, an authorization that was actually obtained, or eligibility that, let's say, the patient actually was eligible. We might still be able to recoup, and that's kind of the point too, to get some money back and to implement any kind of fix for the future.
So when you're analyzing and you're looking for trends and trying to figure out exactly like what's going on with, so you're looking at what's going on with these facilities and why are we getting so many denials from specific areas, and then
sometimes it's a specific payer. Sometimes it's a specific service type. I noticed.
What's an example of what you would do? Like take us through that whole little process.
Well, let's say for one of the facilities, I started noticing that the prior auth reps, we used to have them in each facility. Now we kind of have started to centralize it. But before it was in each facility, let's say Dysport injection. I noticed that they were requesting authorizations for the administration codes, not the actual Dysport itself, which is the actual main expense on the claim, the J code. And that was, I guess, maybe lack of understanding or they needed more training. So they started asking for authorizations for all those 6 codes that are for the actual administration, for making the injection, not for the substance in the syringe. And I noticed that was a trend, so I brought it up on the call and then discussed it with the revenue cycle manager at the facility. And then she implemented a training program for those reps so that they would start actually asking for authorization for the expensive J code, which is what they needed to do. And administration kind of is lumped in. You know, if you're going to give an injection, the administration kind of is part of it. It's kind of bundled into it anyway. So that way going forward, I saw much less J0586, I want to say, is the Dysport injection denials, and it's a smaller facility, so every dollar counts.
Right, of course.
Yeah.
What I want to do now is, can you walk us through your whole career, the whole story? Okay. How did you get started in healthcare?
Okay, so I was living in Puerto Rico, and as we discussed before, I think we turned the camera on, is that I was married in Puerto Rico, and that did not work out.
Uh-oh.
What's that? Clutching your pearls. And so that didn't work out, and I was in need of a job quickly. You can't work immediately when you move to the United States. You have to wait for your green card and everything to come through.
Right.
So you don't want to work illegally, which I didn't. And once that all got settled, then I found this job, and it was with Xerox. Actually, you would think Xerox is a copying service, but Xerox also has outsourced call centers and things like that too. They have.
Oh, I was not aware of that.
Right, at least back then. And so this job was it was kind of a call center job. That was the beginning. I was younger. I was in my, I want to say early 20s, or first part of 20s at least. And I was being trained, and I thought this was going to be answering calls in English. That's what I was told initially, to help Medicare members. And I was like, oh, that sounds good. I want to help some Medicare members. Why not? And I need a job.
Yeah.
So I was trained. The training was extensive. It was 6 weeks of in class, 8 hours a day. And about 3/4 through the training, then I learned that this was actually going to be in Spanish. I think I about fainted, because my Spanish back then was not that great. Having lived in Puerto Rico for just a couple of years, it was, basic. It was basic. It's not great. Not enough to help somebody with medical stuff.
Right, or to even take an exam, I guess.
Yes. So I told the trainer that hey, I was advised this was going to be in English, so now it's Spanish. He said, well, I can understand why you're upset. Maybe there was miscommunication. But he said, why don't you finish the training program anyway and just see what happens, and you can quit after that. Just try it out. Okay. So I finished the training and then went on the floor to take some calls, and was very nervous. Obviously, because I didn't know if I was going to even understand what was being told to me. And it wasn't just for members of Puerto Rico, it was everybody. Throughout the whole United States would be routed, all the calls would be routed to the Puerto Rican call center. So people with Cuban accents, Venezuelan accents, Argentinian accents, Puerto Rican accents, Mexican accents, everything. And I remember answering some calls, and one of the first calls was this older gentleman who was asking me about gotas. And I'm like, I put him on mute. I'm like, okay, un momentito. Put him on mute, and I'm like, hey, next person, what is gotas? Like, he's asking me about gotas, I don't know what he wants. He's like, oh, that's eye drops. I'm like, oh, okay. So I continued on. It was difficult. It was a struggle. But I have to say, once you're immersed in that and you answer and you speak to people so often, besides the Spanish-speaking people were very patient, and they felt like almost like grateful that somebody has tried to assist them in their own language. So they were very cooperative. So I have to say, after 2-3 weeks, I became kind of fluent.
You would have to be if you can survive that.
It was hard. It was hard, but I was motivated, and I do like languages. I was motivated to succeed, and so I pushed myself and I became good. And then we had some people, so it was an outsourced call center for Humana actually.
Okay.
That Xerox got the business of Humana to outsource the Spanish speaking call center. So then we had some people from the mainland, from Tampa, to come over and give us some additional pointers, because it was a startup. It began there. It didn't have anything. We just started it. So we had people come from Humana from the mainland to give more training, give more mentorship and stuff. And then some of those people were like, oh, well, Karin is really good. She really cares and she knows the process and all that. I said, why don't you apply for the same job but in Tampa, and we'll pay you double and you'll get to take calls in English. I'm like, that sounds good.
Yeah. Wow. That sounds like a dream compared to,
Yeah, but it
so
was
much
helpful.
easier.
It was still helpful because it made me fluent in Spanish, and I'll forever be grateful for that.
Oh my gosh.
It's like opens a whole new door for you,
I think so.
Yeah.
Wow.
So and I was looking to move out of Puerto Rico anyway. I didn't really have anything keeping me there. As I said, the marriage was over, and there were some challenges with the everyday life in Puerto Rico, as we had discussed a little bit before. Right. It's a wonderful place for vacation, but to live there every day and to take care of business and go to the banks, do this and that, it was difficult.
It's a bit difficult, right?
So I was looking to move out anyway, so this was a blessing. I actually had an interview. I did it remotely. Back then, remote interviews was not a thing.
What year was this?
This was, I know I was in my early to mid 20s, so that must have been definitely over 10 years ago.
Yeah. Oh wow.
So remote interview was not a thing.
Remote interviews, they weren't. They actually didn't even become like a regular thing until recently.
Until the pandemic, I suppose. But I had this Humana insider already speak for me well, so they made an exception. We did a remote interview. I got the offer. I packed my one suitcase and I moved to Tampa.
Oh my goodness.
That was the beginning of my Tampa journey. So then I worked for Humana for the next 2 years. It was, I think, the most difficult job I have ever held.
Oh, really?
Yeah, being in a call center environment specifically is no joke. Everything is super scheduled. Your break times are exactly scheduled. If you miss it because you're on a call with a member, that's kind of like, oops,
Oh.
sorry for you, because if then you take it later, you are kind of racking up time like in non-compliance in a sense. So call center was no joke.
Oh.
It was difficult, and the calls were back to back, and most people call their insurance company when something goes wrong. So everybody's already automatically pissed.
Oh my goodness.
So it was definitely a challenge, especially emotionally, I think. I don't know, some people are like me, are a little bit more gentle. I like to treat people well, and I kind of expect that in return too. So when somebody's like verbally abusive, that's hard. That is hard. But you learn the ways to manage, and that again teaches you additional skills.
It does, and it also you grow thick skin eventually. If you survive.
Thicker. I don't know how thick, but thicker.
Thicker, okay. Absolutely.
So that was definitely a learning experience. But I did well again. Once I know the rules of how something works, I can.
You seem to do very well everywhere you go.
I was employee of the month almost every month that I worked for you.
Oh wow!
Yeah,
that's amazing.
I was what my supervisor said. I was the most highly decorated new hire that they've ever had in the history. So that was very flattering.
Nice.
That was flattering, but it was hard. I'm not gonna lie, it was hard. It was the hardest job I've ever done. And I've done progressively more difficult roles per se, but they were not more difficult than the emotional piece of it. When you speak to so many people and they're all pissed, it's hard.
So it takes a takes
a toll. You come home, you don't want to do anything. You just want to go to bed. Or cry in the bathtub.
So much negativity, like back to back all day long. That has to be hard.
It was hard, and sometimes you hear I have an accent too. So oftentimes I get snide remarks like, "Oh, you need to transfer me to somebody in the United States."
Especially you're doing Medicare patients, so you're doing older people, and
there was some intolerance, and like transfer me to somebody in the United States. Like, ma'am, I'm in Tampa. Yeah, right. What's your name? I said Karin. Yeah, right, Karin.
Oh my gosh. No.
So for those reasons, that was the most difficult job. I guess I'm glad that I had it because it did teach me all these things. Would I ever do it again? No, I think I would rather scrub the toilets.
You paid your dues, I think.
Yes, I paid my dues. I would rather clean the toilets with a toothbrush, than do that.
You know what? I think you learned all the lessons you need to. You took what you can from that, and it made you stronger. I can tell.
It did, yes. And of course, the Spanish part of it was invaluable because it's not something you pick up on Duolingo, you know. You are immersed, you're doing it, you have no choice but to learn what gotas means and what every other word means that you don't know. Thankfully, I had very nice colleagues
Absolutely.
who wanted to help out, and they were very supportive. So anyway, from there, I applied for a appeals coordinator position with WellCare, which is it was a managed care company, so insurance company.
Okay.
And that insurance company mostly focused on Medicare and Medicaid, basically government-sponsored populations, and specifically more difficult ones, like medically complex ones. So that was kind of like a back office job. I didn't have to speak on the phone with anybody.
Oh, nice.
I could just do stuff on the computer.
Oh, that must have been such a relief for you.
Yes, it was. And I'm kind of introverted. I don't know if I want to speak to somebody for 8 hours, no matter what the setting might be. Anyway, that was basically what happened is that when WellCare as an insurance company might have denied a claim or denied payment or partially denied whatever, then provider could appeal it. So they would appeal saying that, hey, you denied this, however, we believe that this was incorrectly denied and here's why. So I would receive those letters. Of course, everything is electronic, already scanned in. And I would review this and research the circumstances and see if what provider is saying pans out. And if so, I can then overturn the denial and send the claim to pay.
You're the one.
Yeah.
You were the one this whole time.
What do you mean?
Oh my gosh, you are the one. You have like everyone's like life in your hands.
I tried to be the most fair I could.
Okay,
honestly.
I hope so.
I also, I always wanted to side with the provider unless it was clearly unjustified. You want to follow what the rules are. Sometimes the providers truly would just not get an authorization, and if that was the case and there's no extenuating circumstance, then you'll ask it next time if you want to get paid.
Okay.
So you would either uphold the denial or overturn the denial, and if you uphold it, you send a letter explaining why, and if you overturn it, you send it to claims department and let them to re-adjudicate the claim, basically. So that was the job. I did that, and I actually really enjoyed that. And you're kind of like a mini judge. And
yes, absolutely. That's what I'm saying. Like, you held everyone's life in your hand.
I did mostly provider appeals. So
you're the one who was like, I'm gonna pay for your service, and I'm not gonna pay for yours. And you get money. You don't get money.
You need to be nicer and better next time. No, I'm just kidding. I try to truly, follow the procedures, and if there are extenuating circumstances, there's always some gray area in everything. So you try to exercise your judgment the best you can.
Right.
Because you also document your rationale too. You don't just click the button. Everything you do, all the research you do.
Right, I'm sure you're going to be held accountable for every time you say yes to somebody.
Not every time, because the QA is only going to get to a portion of your cases. But you want to be good in all of them, of course.
Right.
It's just a matter of work reflects the doer, so to say. So you want to have integrity, and so that
Of course.
Anytime anything can come under question, you have your justified reasons as to why this case went that way. So you document that each time. Documents, once you put the notes in, they're unalterable. So if there's any other further issue like litigation, God forbid, which is not often but can happen, it's all in there. So I try to do my best with that, and I did good again because I got promoted.
Wow, of course you did good again. You are you.
I like to keep work. Usually work has been the strong.
You're consistent.
I like to do that.
You're consistently good all the time.
Thank you. I try. So I got promoted. It was not an easy promotion to get. Okay. So I went from appeals coordinator to senior appeals coordinator, which doesn't sound like much. You would think senior, you stuck around long enough so you became a senior. No, this one's the hardest one to get because as a senior,
you had to fight.
You had to fight, and you were expected to coach your team members and do all these extra things. So basically, the title was
to hide in your office anymore.
Well, I didn't mind. This is basically coaching your teammates and
of course,
and doing things like that. And you want to be successful as a team too, not just as an individual. So that was kind of a leadership role. We had leadership meetings. We planned different process changes, improvements, things like that together, and then try to have some buy-in from the team also. I did that for another maybe 2 years or so, and then I was invited to apply for a team lead position, which was like the next step. That was where your actual personal caseload gets reduced significantly. You then focus more on, helping the supervisors hire and fire, and there was not much firing going on, I have to say. It was more hiring because it was expanding.
Thank God.
Helping with, coaching and performance, and I did some actual classroom trainings too. Those were the long ones for new hires.
Okay.
Those were like weeks and weeks on, and so that was also a new skill too, because you have to kind of plan the curriculum. And it sounds like you like education a lot. For me, that was just part of the job I had to do. It was not my favorite, but I did it, and people liked it. I discovered the secret to training others well. It was something that was difficult for me at first, is to be like open and vulnerable, because you want to connect with the person. Right. You don't want to seem like you're like some kind of a know-it-all, because nobody is. But it's hard sometimes to be vulnerable with strangers, I have to say. At least that was a challenge for me. Right. Because you want to kind of, sometimes I play the cards close to my vest, so to say. But it taught me to change that. And to share of myself, and share some of maybe my failures. And some of my challenges. Even, everybody has something in the family that is challenging, because that's just family, right?
Of course.
And when you share something like that, and others feel that they can share more too, and it creates different kind of connection.
And you start building bridges with people.
And you do need that bridge, because unfortunately, if it was up to me, then training would be open the brain, pour it in, close the brain, done. But because we humans are not built like that, we need those connections and those bridges.
Absolutely, I know.
For somebody to even accept what you're saying, and why should they listen to you? Right. Yeah. So that was another like soft skill that was developed at that time for me, which was it's difficult to be vulnerable, I feel, because you kind of leave yourself open to.
It is, especially if you're not really used to doing it.
I suppose, yeah.
Right.
And I think I'm more.
And depending on the type of person that you are.
Right. Yeah. And depending on, I guess, life experiences too, because we've all been vulnerable and regret. We've
all been shot down.
Yes.
At some point.
Yeah.
For sure.
So that was that, and then Welker got acquired by Centene Corporation, which is a bigger insurance company. And with every acquisition, I saw the writing on the wall, but I didn't want to stick around to see and kind of what's going to happen. So I looked for a different job, and I landed at Shriners before any restructuring happened. I just wasn't. I just didn't see the point of sticking around to see what happens. I already knew that it's going to be, mostly with acquisitions, there's redundancies, and I didn't want to find out. I didn't want to stick around to find out. I felt like it's time for me to also move on and to explore something different.
Okay.
And analyst role was a good fit. Then, now I'm looking to expand again.
So it seems like you landed up at the opposite side of the insurance.
Yes.
Now you're like, no, stop denying us. Give us the money.
But something that actually is beneficial, I want to say, because once you've some people call it the sleeping with the enemy stage. You learn their ways, so you learn how to get around them.
Oh, I was gonna say, what is it like, kind of being on the opposite end now? It's like now you get to feel the other side's pain.
Well, I always felt the other side's pain too. I was not like some kind of heartless bureaucrat.
Oh, like I know that too. Of course.
But it kind of brings it also kind of a full circle, because you see the claim from the payer end, and it seems this way. From this end, you see what all
totally different perspective.
Yes,
right?
You see what all goes into it to even get it out the door, so to say, electronically out the door. The bill scrubbers, what all needs to happen for it to even go out, and why the delays could happen, and all that. So it kind of brings it full circle. So I'm actually very glad to have worked on the payer and on the provider side. I feel like that kind of provides a more rounded perspective.
I think you are actually, that makes you the perfect person for the role that you play right now.
And hopefully the future roles.
Future roles as well. I mean, hopefully everything that you've done so far will just come together, and just like how I told you, like it all fell, in
the right place.
In the right
puzzle
place.
pieces fit.
Yes. So
I'm working towards that.
And I think that each step of the way, it's like it fit, and then now you're working for the next fit.
Yes, I am working. I'm looking especially to do something, to take on more responsibility after I graduate in May with my master's.
What are your plans, or where do you think that this is going with your MHA?
So, I can't tell you exactly because there are different variables. My partner, he is a physician, but he's a very specialized physician. So he's looking for a different opportunity also right now. And for him, usually getting a new job means a move.
Okay.
So, but for me, I'm more of a generalist. I can be in leadership in any kind of healthcare organization, right? So I'm thinking this is how we're going to do it. He's going to find his gig first, and wherever it may be, then we're going to move there.
It's probably the best way to strategize.
Me, him, and the cat. Yes.
You and the cat.
Yes,
Oh boy.
we have a beautiful Siamese kitty together. and once he finds his, I'm going to see what that area basically has. It might be a bigger city, it might be a smaller city, so we'll see.
Either way.
But I'm looking to move into leadership. Thinking next might be managerial or maybe directorship level once I have my MHA. Because with that, with the 10 years of experience on both sides plus the degree, I feel like I would be ready.
You are absolutely the perfect candidate. I'm not
thank you.
kidding. If you need a letter, girl, I got you.
What do I say? Ashley, who did you use me once?
If that means anything. But yeah, for sure. I think that you're gonna do like amazing anywhere. Well, duh, because you're classic Karin. You're just like everything is good. You do good in everything, but I do think that like everything that you have become is like preparing you for a director role. It's gonna be really great. I'm really excited for you.
Thank you.
I do want to ask. So when. Because you didn't really touch on at what point did you need to get a degree, or did you ever need to get your degree? Because I know that I think when you started in healthcare in Puerto Rico, did you have your degree yet?
No, I did not.
So at what point did you get a degree?
So I started working on my degrees when I was already in Tampa. I did it on the side. So I was always working full time.
Was it necessary for you?
It was necessary for my own personal development. It was part of my goals. The role I have now, the analyst role, did want a bachelor's degree for it.
Okay.
I was actually completing my bachelor's then.
Okay, so it's good that you have it, because you would not have been here if you had not got that bachelor's.
Yeah, this level,
probably
yes. If you want to move into
level.
leadership though, then it's slim pickings with high school diploma, I have to say. Definitely, I would recommend. Yes, leadership, you need a bachelor's. If you look at even job postings, you need a bachelor's for any. Not everything is 100%, but 90% of the time you need a bachelor's to do
almost every.
Yes, and then if you want to go higher, like directorship level or even higher, maybe the C-suite.
You gotta have a master's.
Yes, absolutely.
For sure. Okay, so just to get into the analyst level, you had to have that bachelor's degree.
Well, I have to say I had associates then, and I was finishing my bachelor's, and I kind of sold myself based on my previous experience.
Right, and then they already knew that you were
working on
finishing it up or whatever, so they probably were like, oh, you're already.
I think it depends on the organization too. Shriners, typically I find that most of my coworkers are very highly educated, so that's just the culture, I suppose. Not every place will necessarily require it, but I would not recommend skipping it because really you don't want to just get the bottom of the barrel positions.
Right, and then of course I feel like at a certain point, if you don't have the higher education, you're going to plateau.
Yes, absolutely. Absolutely. I mean, you're going to get advanced only this far with just on your experience alone, but then the credentials will matter because organizations don't want to probably even take a risk. You don't want to say your director is with a high school diploma. That's just not going to fly. Right.
Absolutely. Okay, so lastly, what advice would you give anyone who is an undergrad right now and trying to get into healthcare administration?
I would definitely recommend having some internships or other ways of gaining experience, because degree alone in healthcare also is difficult to break into. So if you're finishing on your bachelor's and if you have a chance to do something maybe part-time even, maybe something entry level, I would take the experience. Or internship if it's available. I would try to get in some hands-on experience. And of course, find a mentor. That's the best way. That's an accelerant. It's like if you start a little fire, it burns a little bit.
Like a catalyst?
Yes, it's a catalyst. It's going to help. Mentors along the way can provide some insight. Mentor who is already in the industry can provide some insight on how to advance in your specific path. I have benefited from some mentors myself. I have one with my current organization, and she's in her 60s, and she's on the finance part, and I feel like her insights are just really invaluable as I consider my next moves. So mentorship and hands-on experience is what I would advise.
Thank you so much, Karin. Thank you so much. This has been an amazing interview.
Thank you, Ashley.
You gave so much information. I think you provide so much value for students. They're gonna get so much information from you, and I think you gave a totally different perspective and just showing people that they can start an amazing career in a different way, in an orthodox way, if you would say, because a lot of students right now, they're kind of starting with their bachelor's, and many of them do not have experience, and a lot of people have in their minds that they're going to graduate and then they're just going to fall into a job. Or they're going to be able to find that job or that entry-level job, and it's going to be easy, or they're not going to have to fight for something, or maybe since they're educated that they would be able to get something above an entry-level position. But I like how you started. You didn't really start there, but you found your way in.
I was not looking for a way in.
You weren't even looking for a way in.
I fell into it.
It was almost an accident. But you fought.
You do have to start from the bottom sometimes. Yeah. To really kind of
you start from the very bottom, and you worked so hard. You learned a whole other language. And then you excelled in that, and then you took every step forward, and I think when opportunities came your way, you were like, let's go.
You have to weigh your risks.
Were not, I think a huge thing is that you were not afraid.
Well, I was
afraid. You were probably afraid.
I was afraid.
You were very brave though, you took a lot of those risks.
You have to think about those, because I think somebody I know, maybe it was you, if you want things to go differently, you have to try something different. So sometimes if it's a calculated risk, do it.
Calculated risk, yes, calculated risk. If it's a calculated risk, do it.
Don't do it just because for the sake of doing it. Think about it. If it makes sense,
absolutely,
and the only thing holding you back is your fear, or you're just being too comfortable in your present position, and you're just scared to see what's around the corner, then do it. Don't hold back on that account. Do think about all the aspects first, and then do it. Sometimes you just have to grab the opportunity, pick the pear off the tree, just do it.
Yes, okay. You are a real high-performing Wonder Woman, I want to say, and I'm really lucky that I'm very happy that we got to do this. I feel very fortunate that we got this interview and we got to make this connection. I really enjoyed our time together.
I did too.
And thank you for all your advice and everything. This has been wonderful. I'm gonna go hit that record button, but thank you so much. Oh. Is it okay if anyone may want to contact you for anything?
Of course. You can reach out to me through LinkedIn.
No problem. We're going to do that.
Okay.
I'm going to put your